Good afternoon. As Guirguis said, we are from the United States Agency for International Development, which is the lead U.S. agency for foreign aid development. We specifically work in the Bureau of Global Health, and today we'd like to provide a brief update on the adventure and how we're implementing that in a new supply chain project. In the Bureau of Global Health, we have three priorities that our work is aimed towards achieving that are listed here, not there. Ending preventable child and maternal deaths, creating an AIDS-free generation, and protecting communities from infectious diseases. And under this, we support initiatives such as the Sustainable Development Goals and the FP 2020 partnership, which aims to reach 120 million additional women with access to contraceptives in the world's poorest countries. Vital to this work is the provision of life-saving products to what we call the last mile. And in support of this, USAID funds procurement of a number of different products. Since 2005, 4,300 different products, primarily in the programmatic areas in the Global Health Bureau of family planning, HIV, and malaria. Last year, we launched a new supply chain project under the Global Health Supply Chain Program for procurement and supply management, GHSC, PSM. We would like to rival GS1 and all the other presentations this week in our acronyms as well. There are three objectives of the project: global supply chain, in-country system strengthening, and strategic engagement. Under the project, approximately 50 countries are being supplied product, and they have presence working on in-country supply chain strengthening in approximately 25 countries. Today, we're going to focus on the global supply chain. What does that mean? And to explain that, I will pass it over to my colleague.
Thank you, Hayley. So I think, as Hayley mentioned, we'll focus today on what we are doing in terms of the global supply chain. So to put this in context, the PSM project is normally going to procure like hundreds of millions value of health commodity, and it will ship it over 50 countries. And the mandate for the global supply chain, it starts from doing the contract and procurement with the manufacturer. They're going to have a regional data warehouse, and then they distribute it to the country until the port of entry. When it reaches the country, it will go after that mainly through the public supply chain in the country, which we also provide through the PSM technical assistance. But today I would like to give you more brief about what's happening at the global supply chain and what we're doing in terms of GS1 adoption for our global supply chain. As mentioned a lot during the conference, it was very obvious for us that with the PSM project and for our global supply chain, there is a lot of very critical problem that can benefit from the adoption of global standard and specifically GS1 standard. We want to increase the efficiency of our supply chain. We had a big problem in terms of the end-to-end data visibility and knowing what's happening in our supply chain. And of course, we want to focus on the patient safety and supply chain security in case of recall and all of the other benefits that we heard across the conference. So let me tell you our journey, which I'm a little bit cannot believe that it's almost 3 years now when we started this journey about the adoption of standard. So our journey started around June 2014. This is where we have been working with our colleague from UNFPA and trying to coordinate our supply to countries and so on. And the exercise was supposed to be an easy exercise. It turned out to be a nightmare just to identify what product and how we can coordinate our product. We found out at this point that for the same product, we may have around 30, 40 definition for the same product in our supply chain, same with the UNFPA, and trying to make this unique identification, it was very, very difficult. During this same time, our colleague from UNFPA started to get introduced to Oracle and to the GS1. and they contact us and told us, okay, we have the magic solution to all of your problem. And we start learning about GS1. We got also introduced to Orica, which we realized very quickly that a lot of our problem in terms of interoperability, in terms of data visibility, the identification of product, it really can get addressed by GS1. We thought we were a little bit naive at this point. We thought, yes, we can do it all, maybe a couple of months and can take it, and everything can be GS1 compliant. But of course, when we start to dig more, we find that there is more things that need to be done in this area. So after that, we heard also about the VPAC group, which we just heard about them from the vaccine side. We joined them just to learn what's happening in this area. And then we also realized that really the main advantage and a lot of gain will happen for the piece of the country supply chain. And this is where we didn't want to move ahead much before being sure that what we're going to propose or what we're going to do at the global level can be also applicable at the country, and the country can benefit from it. So in late 2014 or early 2015, we launched like 2 pilot projects in Pakistan and Ethiopia, which I think we heard about them. And it was like 6-7 months pilot, testing the barcode technology, testing how it can be integrated into their logistic management system, and how it can provide feasibility and tracking for the supply chain inside the country. And we presented, both countries presented the result of this pilot in the GS1 conference in Budapest, and it was an eye-opening for a lot of us. First, this was the first time that in most of our field, it was very little knowledge about global standard, about why we need global standard, about the GS1, about the benefit of the barcode, and how it can address a lot of the challenge that we have been seeing every day. So this pilot, it was the beginning where the country also started to realize the benefit of adopting of the standard, and this was the starting of a lot of the great work that is happening now in Ethiopia and in Pakistan, and hope that more countries to come. After that, so this is where we also, after that, with UNFPA, start to realize that big challenge, or the main starting point, that we need to start working closely with the supplier, and this is where we established the Reproductive Health Global Traceability Group, which is working, advisory group working with the various suppliers to provide us with a timeline and recommendation of how we can approach the problem of having the supplier being ready for our commodity. We also start to take this more to the wider discussion from the donor community. So there is multiple group within donor with Gavi, Gates, WHO, Global Fund would coordinate this topic, because we find that each of these groups have the similar interest, but it was mainly like more of a parallel effort. So we brought all of the discussion in one forum, and this is gaining more and more momentum to work together in moving forward. At the same time, in 2016, this is where, as Hayley mentioned, USAID have awarded our large contract for both the global supply and technical support, the PSM, and this is where we put it as one of our vision, or one of our strategy, that PSM will be adopting the GS1 standard, and we'll talk more on this as we move on. So this was like a quick history of our journey, and we'll focus in the next few slides about some of the donor coordination and the engagement, and what is the main element of our strategy, both from the supplier side and from the IT system side. So back to Hayley to tell us about the strategic engagement.
So as Ramy said, it became important, and we heard this very clearly from our suppliers, that if the community is moving in this direction, please move together. And that, of course, is the emphasis behind having a global standard. We have existing coordination mechanisms, and coordination is difficult, but we learn that we have to use these to share information. How this works out in terms of a roadmap, we are continuing to collaborate on. And this picture here is from a supplier summit held last month, and it's a panel held together with UNFPA and the Interagency Supply Chain Group, which includes membership from many of the organizations whose logos appear on this slide. We want to implement these for the reasons that Ramy said, and we also want to do so in a way that is coordinated for the supplier community, and so we needed to hear from them. And so using the version, using the example of the VPAG, the Reproductive Health Traceability Advisory Group, was established to hear from reproductive health suppliers. And I just would like to share a few lessons that we learned from that. Out of it was produced recommendations on what should be adopted, and it will, I do not think, come as a surprise to the community in this room. It was to adopt global standards, to address it in a phased approach, and that there is not a one-size-fits-all solution for all product categories and all suppliers. This document then became the key input for the development of a roadmap under the PSM project here, which they've organized to share with you using the language of identify, capture, and share with the requirements. And it's phased out, and right now they're in the process of determining the phases and breaking down the suppliers, and continuing to do this through communicating with the global forums that I presented previously. And these are examples of the requirements. Oop. Identify, capture, and share.
So this strategy, so basically when the PSM project started, there was a lot of pressure that establishing it, it was a large 8-year, $6 billion contract. There was initially a lot of pressure for setting up the project, setting up also the IT system, and having the project ready for receiving order and continuing the distribution of health commodity in uninterrupted fashion. So a lot of things was happening in the first year. And of course, as we all know, when everything is in rush, standards may not always take the top priority. So there was a huge investment in building the IT system and making it running to support the procurement, to support the ordering. And we realized that this may have compromised our main vision of the adoption of the GS1 standard. So in November, last November, PSM had a contract with GS1 a consultant company specialized in GS1 implementation, and they helped us in develop the strategy from both the supplier strategy, but also to make an assessment of the compliance of our IT system to the GS1 standards and what's need to be done for any non-compliant aspect. And the focus mainly was really how to support, it was a big focus of how to support the product identification, the G10, and how to, our catalog where it initially was built was based on our own identification. It was not fully compliant with the G10. And they came with us with all of the things that need to be changed. And big part of it was about the e-catalog and data management, and also the strong recommendation that we need to subscribe to the GDSN that we all heard about it many times during this conference. So we issued, PSM issued an RFP for GDSN. We hopefully that this will be awarded soon, and we are now in the process of how to fully update or change our e-catalog to be depending on the GDSN and make all of the required changes from both the G10 but also from all of the attribute that we will need to maintain. And this will be one of the major step forward, not just for us, but the whole purpose here. We wanted also to make it easy for other donors when in the future that they can also subscribe to the GDSN and with the country, and we all working on the same master data, which should enable us to monitor and have much easier data visibility and avoid a lot of the manual work that we are currently doing. So very soon we are expecting that the GDSN contract will be awarded and we start doing the changes in our e-catalog, and then also the GDSN vendor will be, supplier or solution provider will be working with our supplier of receiving the data from the supplier and make it available in the GDSN. So I hope by the next GS1 conference we can tell you that our e-catalog now and the GDSN is fully integrated to our system, and hopefully also we can talk more. And the preference, of course, now all of the work is doing in the country. It's fully owned by the country, so we can hear more and more about the progress that is happening in Ethiopia and Pakistan, and hopefully other countries will be joining us in this journey. And this is just a picture, one picture here show you one element of our supply chain, how sometimes this is what we need to do to reach the last mile for commodity. And some other picture in the corner, it was about when we have the pilot for the GS1 and the barcoding. Thank you so much for your attention, and special thanks to GS1 and to Erica for all her support during this long journey of our adoption to GS1. Thank you.